Hola, buenos dias, good morning, everyone. Just sort myself out here. So let me start by thanking Jean and Alzheimer Europe for the very kind invitation to be here today. I'm delighted to be at this event and happy to provide you with an overview of some of the developments and activities that have been going on at WHO and through its partners. I thought I would actually devote one of my minutes to explaining a bit about WHO because it's a complicated organization and there are different sort of levels of it, which I thought could be useful just to quickly outline. So, you know, WHO is a specialized agency of the United Nations working in the area of health. Of course, it's headquartered in Geneva, as you know, but it has these 6 regional offices. So, you know, one for Africa, one for Asia, one for Europe, and so on. The European office is based in Copenhagen, and overall, WHO also has around 150 country offices, mainly the low and more low and middle income countries in the world. The European region is this vast area. Has about over 50 member states or countries, part of that, stretching all the way from not only Western Europe and Eastern Europe, Southern Europe, the Caucasus, Central Asia, and former Soviet countries. So this vast region with very different demographic trends and epidemiological situation. The mental health and neurological work program sits in the NCD area, non-communicable disease area, as well as with the promoting health over the life course, including aging, of course. So, for example, the team or the program that I'm working in works with around 25 member states or countries in the area of mental health and neurology, so the promotion and protection of mental health, as well as the identification, management, and follow-up of mental and neurological disorders. In different areas, you know, policy and planning, but also service reform and reorganization, surveillance, monitoring, evaluation. These are the typical kind of, you know, WHO functions in these countries. So I thought that provides you a bit of the sort of boring but sort of institutional context of this. Just so you see that. But you'll understand that in this kind of ambitious, endeavor, we absolutely, rely on strong partners, not just other international organizations like the EU and OECD and so on, but also at the national level, national associations, and with academia. So I just wanted to, I'm really happy to say that just a few weeks ago we had the regional committee in Europe, and as of a few weeks ago, Alzheimer Europe is now fully accredited with the regional office of WHO in Europe, and that's really good news because it sort of formalizes a bit more the relationship that we have, and then so that we can partner together and collaborate more closely in addressing the mounting an effective response to dementia in these countries in Europe. So that's great news. Okay, so let me move to what I'm here to talk about, which is a bit about the WHO Global Action Plan. So maybe a quick straw poll. Who knows about this plan and is sort of feels comfortable about it? So I would call that about 10%, maybe not much more. So good, I need to be here then. You need to know about this. So the context, of course, as you know, is that we have aging populations throughout the world, particularly in low and middle income countries. You can see, if I go back and do that again, the change that we're seeing over time. So we already have 50 million people living with dementia in the world. That stands to double by 2050, and so will the costs, of course, associated with it. So we have this huge challenge ahead of us. Europe is a good example of a region which already has a a very quite aged population compared to other parts of the world, but we're still seeing very rapid aging of those populations, particularly in some parts of Southeast and Eastern Europe. So that's in a nutshell, the challenge, that we know that with aging populations, we will have, without some disease-altering intervention, an increase in the rate of dementia. So we're having around 10 million new cases per year, which is around 1 per every 3 seconds. So with this context in mind, the member states have endorsed a global action plan on the public health response to dementia. So this was a process that was started pretty much after the first ministerial summit and was very rapidly developed in full consultation with all relevant stakeholders. And this was the all-important document where we have the endorsement of this document by all 194 member states of WHO. And as you see here, the task is to develop ambitious national responses to the implementation of this global plan, and we will have regular reporting back to the World Health Assembly every 3 years out till 2025. This is important because what other documents do we have at our disposal to try and bring governments to account? We're not in a great era of accountability, you might have noticed, but this is an important policy commitment by all of the countries, not just to be more aware, but to act on this huge challenge. So the vision and the goal, shared with many other similar documents, proposes a world in which dementia can be prevented, people with dementia and their carers can live well and receive the care and support that they need to fulfill their potential and live with dignity and respect. And there's a number of principles that underlie the key action areas for this plan, including empowerment, human rights, equitable access to services, and so on. So in these kind of documents, there are specified actions or activities that are required or expected, not just from the member states themselves, but the WHO Secretariat, and also its partners. So I already mentioned partners. This is a kind of a more lengthy list of the different partners who are directly needed and involved in the implementation of this action plan. The action areas, I'm not sure you can see. Let me read these out. So there are 7 action areas. The first one is in the area of policy, dementia as a public health priority. I'll say a bit more about each of these. Number 2, dementia awareness and friendliness as an action area. 3, risk reduction, so prevent what can be the modifiable risk factors that can be acted upon. Number 4 is dementia diagnosis, treatment, care, and support. And then 5, the specific action area on support for dementia carers, which is extremely necessary. 6 and 7 are around the information and research agendas, respectively. So let me say a bit more about those, what they cover. So starting with the dementia as a public health priority. So this is clearly around about developing better governance for mounting an effective response, public health response. And for that, we need articulated policies or plans in the area, legislation that protects, for example, the rights of persons, including not just human rights, but also social protection, financial protection. And also money. So we need to have a better idea about what it's going to take. It's all very well having a policy or a plan. We all know those can easily stay on a bookshelf and not be implemented. So it's important to build in the financial considerations at that preparatory level, if you like, or that fundamental level of good governance. Turning to the awareness and friendliness, of course, there's a much greater need for more information, awareness, appreciation of this area. So public awareness campaigns or initiatives are important, as well as the dementia-friendly initiatives that many of you are already involved in or aware about. Number 3 is around the risk reduction. And it is really important to note that, of course, the risk factors that are underlying onset of cognitive impairment and dementia are shared with many other NCDs. This says NCDs, but of course dementia is a non-communicable disease, so this should say other NCDs, including cardiovascular disease, diabetes, and so on. And the risk factors that underlie those other NCDs, smoking, alcohol use, physical inactivity, and unhealthy diet, are things that we can all work on to also modify the risk of cognitive impairment and dementia. So that's a really important aspect to have included. Moving to action area, I think this is 4, the dementia diagnosis, treatment and care. So part of this is around having stronger guidance or guidelines around appropriate and effective pathways through care, through the and service system, and the associated training and educational needs of the different elements of the workforce. And as well, of course, a need to try and shift the locus of care. Too often, in too many countries, I'm afraid to say that people with dementia, if they're not living with their families, are left or literally dumped in institutions where they have an appalling quality of life. So this is an extremely important area of needed activity. 5, around the support for dementia care area, we know about that, the need for better training, education programs, as well as stronger opportunities for empowerment and inclusion. And then the last 2 is, I will say a bit more about the Global Dementia Observatory in a minute, but basically how do we do a better job of monitoring what is happening or and put in place a better framework for knowing that actions that are taken are being monitored and evaluated and can therefore be fed back to policymakers showing action and impact. So for all of these areas, there are specific targets, and for example, that we think that globally, 75% of countries should have a national policy or a strategy or a plan. For example, 50% of countries should have a dementia-friendly initiative, and so on. Now, some of these might seem quite low, particularly in parts of Western Europe where maybe you have all of this stuff, but this is a global level of monitoring. And so I think in the European region we can probably imagine exceeding these targets with any luck. Now this is the slide which sort of brings this together. These are action areas on the left-hand side, and on the right you'll see a bunch of tools and resources. This is what, for me, marks this out as a particularly useful action plan, because often we produce action plans, but there isn't the supporting guidance or documents for countries to actually act on them or implement. So if I take some examples here, I don't have time to go into all of them, and I will mainly talk about the Global Dementia Observatory. But if we take the first one, for example, a recent document I got right here is a policy guide. So it's nothing, out of the ordinary. It says, you need to do a situational analysis, you need to build a team, you need to do this planning, you need to put in a monitoring, a framework. So, but the point about it is that it's extremely focused on dementia as a topic. So it's asking all the right questions and giving a lot of different examples from other countries who've already developed their policies, and so you can benefit from that. There's a dementia-friendly toolkit that has been developed. Some risk reduction guidelines are in preparation. We have a toolkit for the actual identification, management, and follow-up of dementia in non-specialized, settings, primary health care. An e-portal system called iSupport for dementia carers. which you can look at, and a research prioritization exercise. So these are examples of some of the tools. So the one you'll see on the right is this Global Dementia Observatory, because that kind of touches on all of those, because it's the means by which we can monitor and progress towards moving against these different objectives of the plan. So you can see the website there. And by the way, the presentation that I hope will be made available has got a much more extensive set of slides, which will go into each of these different action areas. But just to say that the Global Dementia Observatory is meant to be not just a kind of a data repository, but it's also an opportunity to exchange knowledge and information between countries. So I would urge those of you countries who are not yet participating in this to look into it and advocate to have your government participate in this observatory. So I think I'm there. I think I just wanted to show you this last one, which is the end sort of product. It's an example of a country profile that would be the output, if you like, of this, and of course you would be able to compare your country with others in the region or globally or whatever you want to do. So we see this as a really important complement to the different other areas of action. So on that note, I think it just leaves me to say thank you for your attention. Have a great day. Enjoy the conference.